Colposcopy, what you need to know. If you're booked in to have a colposcopy, or if you're interested in finding out more about what a colposcopy entails, then this video is for you. You may be referred to colposcopy because your cervical screening test has suggested there may be some changes to the cells on your cervix. It could also be because your healthcare provider recommends your cervix is checked. The colposcopy procedure is free if you're eligible for public health services in Aotearoa, New Zealand. You can also arrange to be seen at a private clinic. Before your appointment. It is important to attend your colposcopy appointment, even if you don't have any symptoms. Please phone or email the clinic if you need to change your appointment for any reason. If you have your period on the day of your appointment, phone the clinic as soon as possible. If it is difficult for you to attend the appointment, for example, because of transport or childcare, contact the colposcopy clinic as support options may be available. If you need an interpreter, or if you have a disability that makes it difficult or uncomfortable to have the procedure, let the clinic know. Please tell the clinic if you are pregnant. It is safe to have a colposcopy when you are pregnant. However, it is unlikely a biopsy or treatment will be recommended during pregnancy. At your appointment. A specialist doctor or nurse carries out the examination, and a nurse will also be there to help you. Your appointment may take up to an hour, although the actual colposcopy only takes about 15 minutes. You are welcome to bring someone to support you, such as a partner, a family, or whānau member or a friend. What is colposcopy? A colposcopy is a safe and effective procedure where a specialist uses a microscope called a colposcope to view and check the cells on your cervix. The colposcope looks like a pair of binoculars on a stand. It magnifies the cervix so that cell changes can be seen. During your colposcopy. At the start of your appointment, the specialist will talk you through what they are going to do and answer any questions you might have. You can ask questions at any time during your appointment. There will be a private space for you to get undressed, and the nurse will explain what you need to do. You may want to use the bathroom before your examination. In a private room, you will be asked to lie on a bed with your legs placed in leg rests. The specialist will put the colposcope near your vagina. It will not touch your body. During the examination, your support person is welcome to stay with you if you choose. A nurse will also be present to offer support and assist the specialist. The specialist will then gently place a speculum into the vagina. This makes it possible to clearly see a magnified view of the cervix through the microscope. The specialist then applies liquid onto your cervix to show up any cell changes. Some people find this stings a little. Small tissue samples may be taken of cells in areas where changes are noted. This is called taking a biopsy. When the biopsy is taken, you may feel a quick pinch. The specialist will let you know when the colposcopy is finished. After your colposcopy. Before you leave the clinic, the specialist will talk to you about what they saw during your colposcopy. You can ask questions at any time. If any biopsies were taken at your appointment, the clinic will provide aftercare information, including contact numbers, in case you have any questions or concerns. After colposcopy, you might feel cramping similar to period pain. You can treat this like normal period pain. If you had a biopsy, you may also get some bleeding or reddish discharge from your vagina, which may last a few days. This is normal and should stop within a week. If it lasts longer than a week, call your colposcopy clinic. Until the bleeding stops and your cervix is healed, please use sanitary pads, period underwear, not tampons or period cups. Have showers instead of baths. Do not use spa pools or swimming pools. Do not have sex or place anything into the vagina. If you start to bleed more than when you have your period, or if the bleeding goes on for more than a week, please phone the clinic for advice. The colposcopy clinic will provide a letter with information about what to do to address any concerns you may have, especially outside clinic hours. Getting your results. If you've had a biopsy, your sample will be sent to the laboratory to find out exactly what sort of changes are happening on your cervix. It can take up to 4 weeks for the clinic to get your biopsy results. If you have not heard from the clinic within 4 weeks, please contact them. Your results will also be sent to the National Cervical Screening Program, as well as your health provider. The results of a biopsy may show there is nothing wrong with the cells on your cervix. Sometimes you may need another colposcopy if your biopsy results are not clear or you require ongoing monitoring. Treatment. Sometimes a follow-up cervical screening test or colposcopy is recommended instead of treatment. The specialist will advise if you need treatment for any cell changes. The type recommended will depend on the type of cells, where they are on your cervix, and the size of the area with cell changes. The specialist will discuss the treatment options with you and when this will be booked. If you have any questions after your test, or if you need a follow-up appointment and you haven't heard from the clinic for 2 weeks or more, please contact the clinic directly.